question here, is there any reported case of death among young people due to cerebral infarcts? What's the prevent? I think what's the prevalence? I think that's what's meant to be written in the question by the audience. What's the prevalence, or maybe they meant how do you prevent if there is any
Yeah. So
case? Yeah, Keith, please.
yeah. So as I mentioned in my talk, Mount Sinai actually reported a case series of 5 patients under the age of 50 that had had strokes. So this is definitely an issue that we're becoming attuned to. I still think it's probably a very rare event. I'm not sure that there's any sort of reliable estimate of the prevalence at this point. And in terms of prevention, I have actually already seen some mention in the lay press of, should people be taking aspirin? And I think it's way too early to even speculate. There's no evidence to suggest that there's any benefit to taking things like aspirin to prevent thrombotic complications of COVID, particularly if you don't have COVID. So yes, this does seem to be a phenomenon, but we don't really have a good sense of how frequently it does seem to be rare, or what, if anything should be done about it.
Thank you very much, Dr. Siegel.